Hi guys, so just a quick news update on coronavirus. As of Friday night, we were sitting at 202 people in South Africa. That had jumped up by 52. And a big concern was the Free State, which had one case, then 7 cases all of a sudden. And interestingly enough, some travelers who had come from certain countries had attended a church service of 200 to 300 people. They're trying to figure it all out and concerned that there was a spread at that church service. At the same time, there's a church in Katlehong in Gauteng that wanted to go ahead with meetings, and the Department of Health has actually obtained a court order against that church. And a bit of chaos at airports. Foreigners were being led on planes from their countries landing in South Africa, and then suddenly South Africa was implementing the travel ban, saying they couldn't get off the aeroplane. South Africans can return though, and in the news some concern that the South Africans coming off those planes and also off a ship in Durban Harbour was simply screened for fever. The NICD says that's all they can do. Basically, you can't quarantine everybody and test everybody, but they were checked for this fever. That ship in Durban Harbour had taken off to go to Mozambique the day after President Cyril Ramaphosa said no one should go anywhere. So some concern about that. So where are we now? The infection rate is rising significantly. There's been jumps in recent days, and we could see much more of that. The health minister talking about 60% of the population of South Africa ultimately infected. Other estimates 70%. So it looks like all of us will be infected or affected in some way. And I guess it's worth just noting that most people get better. A small percentage of people get very sick and need hospital. And what they're trying to do, like Wayne said, is to flatten the curve or limit the number of people who are sick all at the same time, because hospital facilities cannot cope. And there is a stark reality that there could be millions who need help, and suddenly there's just not the resources. The United Nations Secretary General the other day was talking about Africa specifically, saying that the developed world has to step in. Otherwise, there are potentially catastrophic consequences. So that's the horrible reality. And again, just why social distancing is so important, why flattening the curve and making sure that not everyone gets sick at the same time is so important. And Bev asked for what I thought on a personal note, and just, yes, I'm a bit scared like everybody else. I think there's going to be huge unemployment, and we already have that in South Africa, poverty, starvation. So SABC is thinking of sending a whole lot of contractors home, a lot of companies already laying off staff, and that's the last thing we need. And I have a 3-month-old little daughter, and I'm not sure about her immune system. I did read a study that children, they seem to be largely unharmed, but amongst those who get ill, there was a disproportionate number under the age of 5 who got critically ill. So it's horrible, and I just think, though, I cling to the fact that why would God give us a gift to take it away, and that He is bigger than all of this, bigger than COVID-19. All right, so that's it from me, a little news update. Ciao.